And in medical rounds today, substance abuse is an issue that affects all of us, and COVID has certainly magnified the impact in so many ways. August 31st, which is coming up, marks Overdose Awareness Day. Here to talk about the important topic is Dr. Jonathan Craig Allen, Vice President of Addiction Services with Hartford HealthCare. Doctor, thanks so much for being with us.
Thank you, Cara.
So COVID certainly took a toll on those suffering from substance abuse. Just how bad was it from your vantage point?
Well, pretty bad. In 2019, Connecticut had the highest numbers ever of people dying from opioid overdoses. And with COVID and the quarantine and the stressors and the anxiety, a lot of treatment programs were hard to access, community support programs hard to access, and harm reduction programs hard to access. And to top it all off, fentanyl, this really, really potent opioid, has been mixed into the supply, and it's dangerous.
So you want to get people help, but what do you do to fight the stigma of addiction and actually get people to get the treatment they need?
Well, you want people to understand that opioid use disorder and all substance use disorders are chronic and recurrent diseases, but because they impact the way people think and the way people behave, it's hard to see them that way for some folks. They behave the same way, though. They respond the same way. You want to prevent them. If someone's developing one, you want to intervene early, but most importantly is to get treatment if you have a substance use disorder or opioid use disorder.
So what services are available to help people?
Well, the gold standard is medication for opioid use disorder. So FDA-approved medications, one of which is buprenorphine, another name for it is Suboxone. And with a change in the federal law, any healthcare provider, any medical provider can write prescriptions for that medication if they're comfortable. At Rushford, we have inpatient, outpatient, in-person, virtual treatment to help to support people. But if someone's not ready for treatment, then reducing the harms are very important. So having naloxone, the opioid overdose reversal medication, is really important, and don't use alone.
Right. And in honor of Overdose Awareness Day, tell us about an event that's planned actually for Saturday.
Yeah, so Opioid Overdose Awareness Day is an international effort to decrease the number of people dying from opioid overdoses. And this Saturday, Rushford, along with the city of Meriden and Meriden Healthy Youth Coalition, are going to be hosting this Overdose Awareness Day event from 3 till 6 at Hubbard Park. It's going to be here in Meriden. It's put on to acknowledge the loss of people and the grief that families and friends are suffering, but also this is focused on getting people help. It's a family-friendly event. There's going to be concerts, naloxone training, interactive games, and community vendors. So it should be a sad experience, but also a hopeful experience.
Absolutely. And important information. Thanks, Doctor. We want to let people know that you can visit rushford.org. The information's right on our Channel 3 app. You can connect right to the website and get people and your loved ones the help they need. Thank you so much. And here are today's local steals and deals.